I lost my nana to a glioblastoma. I was in year 9 at the time. He sort of got unsteady and fell and got worked up for the diagnosis. And we lost her within 12 weeks. So, but it's interesting. I do have that connection, but I didn't purposely go into neurosurgery because of that. So it's interesting how life guides you in certain ways. My name's Hayley Henley. I'm a nurse working out of the Royal Adelaide Hospital in the brain cancer nurse consultant role. So my background is in neurosurgery, so I worked out of Flinders Medical Centre for the last 11 years on the ward and providing care to those that first presented with symptoms. But obviously being on a ward nurse and providing that inpatient care, we didn't really get to see anything beyond when they were discharged. So when the opportunity arose for the brain cancer nurse consultant role, which is the first in South Australia for adults, I thought it was a really good opportunity and sort of be a support person through their whole journey rather than just at the diagnosis stage. So I'm a point of contact for patients once they're diagnosed, so they can often call, email, text me with any problems that arise. We problem solve, liaise with all the medical teams. So I work in between neurosurgery, medical oncology, radiation oncology and the palliative care team. I attend multidisciplinary meetings and also go up and assist neurosurgery with disclosures of diagnosis and provide sort of that education and emotional and practical support. Currently, it is for high-grade malignant tumours, so grade 3 and above. And so we aim to have a pathological diagnosis, and then I'm able to sort of enter in their care and go over some support services, help patients navigate the healthcare system, make sure they're linked up to the right teams to follow through on their treatment journeys, and subsequently follow them up during treatment, after treatment and beyond. And so to get sort of in contact with myself, the neurosurgery team often refer patients once there's a diagnosis. Sometimes I reach out to people after we've discussed in MDT and introduce my service, and it's a voluntary service, it's not compulsory, so if patients don't want to engage, it won't alter any treatment pathways that they're linked up to. The NRF pack is a really good resource and lists all the support services in the brain tumour field, so I always give someone a pack that they can read at a later date if they're overwhelmed, or if they're some people are quite eager to know what's involved in services, what they can access. So I go through sort of the key areas with them, one being the Cancer Council, so I often give them the Understanding Brain Tumour booklet, and then often the Peace of Mind Foundation is a really good support service that I refer, or they can self-refer to. So I always go over with the patient that there is an Adelaide-based support group that they can go meet up with in person, because some people don't enjoy the online, and that they can go and speak to other people in similar situations. And my other key thing is linking to social work for that counselling services side of things, and how it's going to impact on finances for people. If they're open to social work, I highly recommend having a consult with them. Another part of my role is to support patients onto clinical trials where possible. So being at the RA, there's the clinical trials team here, so I often just refer patients that are interested in any trials, refer their name and their situation to the clinical trials team, and then if there is anything available for them that they're aware that they're interested. It's that relief of just having, I guess, a person involved that's been there from the very start, but as well, my days that I feel like I've accomplished something is when we've been able to successfully link patients up to some support services in the community, and for me to be able to say, hey, look, you've got this information with all these lists of support services, but for me to actually say, I'll do the referral for you, or I'll ring this person for you, or let me talk to the medical team for you, like that just seems to take a load off of them, and then I can get back to them with an answer, and that they've not had to sit on the phone for a long time, trying to work out what to do. I think that's the big feedback, is that I'm able to take that some of that pressure off of them. Yeah, I think my biggest advice is allow yourself to process the diagnosis and let those feelings in however you may feel. Just let yourself have some time. And then I also would say, know that there's support out there for people. I think it's just overwhelming when you have a diagnosis to then hear about all the support services. So I really try and I guess sit there and work out what they may benefit from the most at that time. In the 6 months that I have been in this role, I've able to provide support to around 75 patients and their family.
Yeah.
And that, I guess we project that over a year that will be probably double or a little bit more over double. The aim and the hope for the future is that we could support more types of brain tumours. So I thank all the supporters that fund the NRF. Without you, we wouldn't be able to support families and patients going through a brain tumour diagnosis, and that gives them hope and something to look forward to for the future.